Well, you are most welcome to today's talk. Now, today we're going to be looking at some of the implications and remarkably good opportunities afforded by this.
What is this one?
Withdrawing from the World Health Organization. Sir.
Ooh, that's a big one.
And I suspect a few of you are going to quite enjoy this video. Now, this is the current funding from the World Health Organization here. And we see that the United States is by far the biggest funder. And then after that comes something called the Bill and Melinda Gates Foundation. And after that comes something called the Gavi Alliance. And after that comes the European Union. I'm sure I've heard of Bill and Melinda Gates somewhere before. But anyway, that's not the topic of today's talk. Let's get straight down to some of the detail. So that's the funding there at the moment. Here is the withdrawal agreement. And you can read the whole thing for yourself. Some of it's a bit legal sort of wordage, but most of it's incredibly easy to understand. And it's only a few-minute read, and I think you would quite enjoy it. In fact, I'm pretty sure you would quite enjoy it, at least the vast majority of you. So this is the reference to the funding data from Statistica. Now, this is from the withdrawal agreement now. Withdrawal of the United States from the World Health Organization, released by the White House, by the authority vested in me as President, by the Constitution and laws of the United States of America is hereby ordered. Section 1. The United States noticed its withdrawal from the World Health Organization in 2020 due to the organization's mishandling of the COVID pandemic. That arose out of Wuhan in China. So in 2020, there was a discontent about the what was perceived here as mishandling of the COVID-19 pandemic. And of course, I think the majority of us would agree, and it came out of Wuhan, China. And the United States is also looks like, what's the word? Mishandling of other global health crises. Its failure to adopt urgently needed reforms and its inability to demonstrate independence from inappropriate political influences from World Health Organization members. Now, of course, this doesn't detail who those members might be or who those contributors might be. It merely states the words we've given there. That's all we know about that. But there's more to come. Here we read, in addition, the WHO continues to demand unfair, onerous payments from the United States, far out of proportion to other countries' assessed payments. Some detail here. China, with a population of 1.4 billion, has 300% of the population of the United States, yet contributes nearly 90% less to the WHO, which does seem unfair. I completely agree. Now, the actions. The United States intends to withdraw from the World Health Organization. Now, the thing that's interesting and exciting about this is, if we look at the funding here, the United States is currently contributing to the United States to the World Health Organization. We find it's it's basically $1 billion, $958 million, not far short of $1 billion. Now, just think what that money could be put to. I mean, I can think of a few ideas already from my work in Asia and Africa. I've got some ideas of how the money could be spent massively more efficiently than it currently is. And in the United States, they're not short of brilliant people. And of course, they can employ people from around the world to assess this situation, because the people in the United States are a good, generous people. I believe they genuinely want to help global health. And they have the capacity to do so for fractions of this amount of money. I believe they could achieve way, way more by organising things themselves, appointing their own experts, organising their own programme, instigating their own expertise around the world through proper analytical, scientific, evidence-based community health projects. And we have the ability to do that. I'm not saying there's not risks that big corp could get undue influence. That will have to be guarded against. There will need to be some independent adjudication, and there must of course be complete freedom of speech to critique what's going on. But the potential here to unleash global expertise in the health and medical sector and the scientific and data collection sector is in my view, immense. So many projects just don't get off the ground. Some brilliant projects don't get off the ground through lack of funding. And again, I can suggest one or two if anyone wants to talk to me about that. Now, let's go on with what this is saying. Actions. The presidential letter to the Secretary General of the United Nations signed on January 20, 2021 that redacted the United States July 2020 notification of withdrawal is revoked. In other words, the United States sent in under President Trump on his first term notice to revoke, but that revocation was revoked by President Biden. In other words, President Biden undid the declaration to leave that President Trump had put in. That's now gone, and the declaration to leave is now firmly back in. I'll just flick that on the screen again because you'll probably quite enjoy seeing that. There we go. The Assistant to the President for National Security Affairs shall establish directorates and coordinating mechanisms with the National Security Council apparatus as he deems necessary and appropriate to safeguard public health and fortify biosecurity. So these things will not be left in limbo. The organisations in the United States are still going to keep taking things seriously. Necessary to safeguard public health and fortify biosecurity. We need public health safeguarded. That will be done according to this declaration. And we need to fortify biosecurity. We really need to fortify biosecurity. Someone needs to get a grip on all this gain of function research that's been done around the world, sometimes under good conditions of biosecurity, sometimes in conditions that could be argued to be reckless. This needs to be globally controlled as far as possible. Now, of course, we can't control what's going on inside labs in certain countries that could be mentioned, but the United States jurisdiction on this is significant. And that could be, this could prevent a potential future viral or bacterial pandemic, or even a prion, a proteinaceous infectious particle pandemic, or even potentially a fungal pandemic. This could prevent that happening by clamping down on reckless research and leaks of organisms whose function has been gained and increased due to laboratory-based experimentation. There's a real opportunity here to make the world a safer place, I believe. Let's hope this opportunity is taken. The Secretary of State and the Director of the Office of Management and Budget shall take appropriate measures with all practical speed too. Right. Pause future transfer of any United States government funds. There's discussion on how much the United States will have to give over the next year. That's not yet clear, but they should be completely clear of it within a year's time. The USA should be completely clear of the WHO in a year's time in the vast majority of areas. Recall and reassign United States government personnel or contract workers in any capacity within the WHO. So these people that are working for the WHO now can be recalled. And what I would suggest is these people are assessed. Now, it may be that some of them are appointments that were made for, shall we say, non-scientific reasons. Who knows? There might even be some political type appointments. Who knows? But those that are scientific should be assessed. If they have scientific merit and brilliance in their field, they could be re-employed in a new United States-based organisation. And incredible. I know there's been ruminations in Italy about leaving the WHO. I don't know how detailed it is. But who knows, this could start a domino effect where world expertise could be liberated from the World Health Organization and actually used to increase global health really massively and really significantly, potentially. This is a really quite exciting opportunity. Let's hope it is not squandered. Identify credible and transparent United States and international partners to assume necessary activities previously undertaken by the WHO. That is really summarises how exciting this opportunity is. So we want these new situations, individuals to be credible. We want them to be transparent. Absolutely, transparency is essential. External critique, peer review can be inaugurated as long as we have transparency. International partners, let's hope, who knows, maybe the UK will join in leaving the World Health Organization. Maybe not this week, actually. But the potential, if we did, we could partner in these new organizations with the United States. Just think of what could be achieved with other countries joining in potentially. Probably not going to happen in the current UK Parliament. Anyway, interesting opportunities. Assume necessary. So necessary activities. There are necessary activities previously undertaken by the WHO, but these can be potentially done massively better. I mean, just to give one example, tuberculosis is still a massive global problem. Malaria, still a massive global problem. Perinatal mortality, prenatal mortality, still a massive global problem. So many lives just waiting to be saved. But doing so under the right organisational structure will help. Global systems negotiation. While withdrawal is in progress, the Secretary of State will cease negotiations on the WHO pandemic agreement and the international health regulations. Now, as far as we know, pandemic agreement, international health regulations, we're full steam ahead in my country. But the United States is stopping all of that nonsense. And of course, we have, well, it's not nonsense, it's cleverly thought out, actually. So I misspoke there. But we've looked at concerns about this on this channel before with people that have taken this really quite seriously. So good to see, in my view, that the United States is withdrawing from these. In the United Kingdom, we are not. The actions, well, I'm not quite sure what's happening, but I think it's going to go. It's planning on going through this year. So really quite big concerns there. But anyway, good to see the United States is free from this these arrangements. And actions taken to bring into effect such agreements and amendments will have no binding force on the United States. There we go. Now, unfortunately, the WHO is finding itself a bit strapped for cash. So one of their senior officers, Maria van Kerkhoven's put out a bit of an appeal. Consider donating to the WHO via the WHO Foundation. $1, one world. And I think if you look on there, there's probably a link to that. That is from her X account recently. So just to give me an idea, if you're going to be contributing via the WHO Foundation to the funds of the WHO, can you put your hand up for me, please? Can't actually see any hands going up at all. So I suspect there might not get too many contributions from that. Personally, I don't think I will donate to that personally. So good luck with that one. Actually, I think I read somewhere. Don't quote me on this, but I think it was under $30,000 that they'd raised through that. So not quite replacing the money that the United States has been putting in of 958 million. Amazing how much Bill and Melinda Gates is putting in there. According to this, this is according to this organisation here. This is Statistica. Incredible. $689 million. Incredible. And then the Garvey Foundation, 500 million, 500 million. Of course, we're saying nothing about any influence that might have on WHO thinking. He who pays the fiddler may not be calling the tune. Anyway, we'll put the full report now for your delectation from President Trump. But for me, for now, thank you for watching.
What is this one?
Withdrawing from the World Health Organization, sir?
Ooh, that's a big one. So we paid $500 million to World Health when I was here, and I terminated it. China with 1.4 billion people. We have 350 to pay. We have, nobody knows what we have because so many people came in illegally, but let's say we have 325. They had 1.4 billion. They were paying 39 million, we were paying 500 million. It seemed a little unfair to me. So that wasn't the reason, but I dropped out. They offered me to come back for 39 million. In theory, it should be less than that, but you know. And when Biden came back, they came back for 500 million. He knew that you could have come back for 39 million. They wanted us back so badly, so we'll see what happens.
Mr. President,
Pretty sad to think of it. China pays 39 million and we pay 500 million. And China's a bigger country.
Mr. President, you spoke about inflation today in your remarks. What actions are you taking today that will have a direct impact for Americans on their everyday costs to bring the cost down?
The biggest thing and factor for inflation is energy. They screwed up my energy policy. And then they went back to it. You know, they heard it really badly, and then they went back to it, and they started drilling more, but by that time it was too late. Many of these things that we're signing and that Doug Burgum is going to be signing, and Chris Wright, who's phenomenal at, you know, Energy, Department of Energy, we're going to be taking a lot, we're going to make a lot of money from energy. We have more than anybody else. We're going to make a lot of money from energy. We're going to make a lot of money from tariffs. You know, European Union charges us, they have a VAT tax of 20%, but it's really much higher than that. And that's the equivalent, almost the equivalent of a tariff. And they're tough. They're very tough. They don't take our cars. They don't take our farm product. They don't take almost anything. And yet we take their cars and we take their farm product. We take a lot from them. So, you know, we have like a $300 billion deficit with the European Union. So we'll straighten that out with either tariffs or they have to buy our oil. The one thing they can do, oil and gas, the one thing they can do to catch up quickly, buy our oil and gas.
Will you travel?
And they should do that.
Will you travel to China this year?
Yeah, it could be. You know, I've had the invite.
President Xi invited
I would
you
do,
to
yeah,
come this year?
Talking about the European Union and the tariffs, like, what do you mean when you say that the European Union country like, is part of BRICS?
Then a what?
BRICS. You said
Oh, BRICS. No, I was talking about BRICS. BRICS is 6 nations. I think it's 7 nations. And they were looking to do a number in the United States. And if they do that, they won't be happy about what's going to happen to them.
Are you still considering a universal tariff, Mr. President, on all countries?
I may, yeah, but we're not ready for that yet.